So next will be the industrial pharmacy chapter. So to introduce the chapter, we will call upon no other than our Mr. Andrew Tan to brief what is MPS. Oh, sorry, what is industrial chapter is all about. Andrew, the floor is yours.
Okay, I share my screen. Shireen, do you see my screen?
Yeah. Can you put it on? Yeah. Good. Can see.
Can see, yeah.
Yeah.
Yeah, adjust a bit. Okay, good morning, everybody. I'm Andrew Tan, head of MPS Industrial Chapter, and also Deputy President for Malaysian Pharmacy Society. And very good morning to everybody. And this morning, I would like to share what is MPS Industrial Chapter Pharmacy. Okay, industrial pharmacy is a discipline which includes research, R&D, manufacturing, marketing, and distribution of drug products. Okay, before we reach out to the patient, then we have to, as a pharmacy, we need to start with this R&D first, and then come to manufacturing, and then market and distribution. Okay, here MPS Industrial Pharmacy Chapter has been set up to gather all the pharmacists from the industry to work together for the betterment of the profession. So I believe that now more and more pharmacists are working in a corporate or manufacturing line. So in this chapter, try to gather all pharmacy in this industry to get together. So this is an opportunity, and this chapter also helps industry-based pharmacists to fully leverage the value of their academic and experiential training to advance their professional careers. Okay, and I would like to introduce my committee, the basic committee this morning. Okay, I'm the chair, and I have Ms. Hui Sian from corporate. Okay, she's working in a distributor, belongs to pharma. Here I have a mixture of a committee from background relate to all the so-called pharmaceutical association, such as PHARMA, okay, which is a Pharmaceutical Association of Malaysia, and then MOPI, Malaysian Organization of Pharmaceutical Industry, MAPS, Malaysian Association of Pharmaceutical Suppliers. And then the other one interesting is CTFA, the Cosmetic, Toiletries and Fragrance Association. And we have another one which involved in renal, which is a dialysis. Okay, the second person is a swim. Okay, she is her job is more towards cosmetic. And then we have a Shihao, which is an ex-YPC chairman in pharma. And then we have a Sharon and Sharifa. Both of them are related to MOPI. And then Asha, her expertise is in dialysis. Okay, so we have a different so-called representative, so that here I would like to urge more pharmacies to join us to expand this chapter, so that we can advocate for the pharmacies in a corporate or pharmaceutical industry. Okay, what is the aims and objective of this chapter? First is to promote and enhance the role of pharmacists in the industry. Second, to encourage the involvement of pharmacists in R&D and development of pharmaceutical products in Malaysia. And then third is raising awareness among employers and industry executives about the role of industrial pharmacists. I believe that we need to so-called get all these bosses to empower the pharmacists to do their job well in corporate or in a manufacturing line. Fourth is to upgrade the professional knowledge and skills of pharmacists in the industry. The last one is to ensure the ethical promotion of medicines in compliance with the local regulations and thus ensure the patient's safety. So what is our chapter objective? Advocacy. We always advocate for the industrial pharmacy. Why? Because we believe that pharmacists' training and experience as a healthcare provider make us ideally suited for a career in the pharmaceutical industry. Pharmacists play a key role in pharmaceutical industry and are making valuable contribution from drug development to the delivering of drugs to the patient each and every day. And we work to advocate for advancing industry-based pharmacies to leadership position by increasing awareness and recognition among employers, senior management, colleagues, thought leaders, educators, and students of what pharmacists have to offer. Okay, here basically I want to show this graph, this chart. You look at this, we are talking about pharmaceutical industry, and we're talking about a pharmacy is a medicine expert. Why we call ourselves medicine expert? Basically, I think we need to start from the beginning, which is R&D. R&D, as just now the speaker earlier, Bharati mentioned compounding pharmacy. So I'm talking about the molecule and also formulation. If we call pharmacy as a medicine expert, then we must know the detail of the molecule. And we must know how to formulate a drug or a solution. Okay, so we need to start. That's why we advocate pharmacists' role in the industry, which we need to start from the manufacturing, R&D. We research, we need to formulate, and then we need to make the finished goods. And then after that, we register the product with MPRA, and then we need to do the product management, marketing, and then selling, and then go to hospital, clinic, or pharmacy, and then go to the patient. So this is a pharmacy role. So I always believe, backtrack to when I was USM. Okay, I graduated from USM. I remember that in USM, the pharmacy school always train us to know how to formulate, to know how to compound, and to know how to research for the new molecule. And then after that is you call sales and marketing, distribution, and then reach out to the patient. Okay, so I think this chapter will help pharmacists to play a bigger role in this pharmaceutical industry. Okay, then this is a past activity that initiative we have done for last year during the pandemic. So everything is online. So, but we hope that this year, 2022, I think government allow physical activity. So we hope that we can organize some physical activity to encourage all these industrial pharmacy. No matter you are in management, no matter you are in sales and marketing, or regulatory, or production, we get together to share ideas how to improve the role in this industry so that we can take charge of the whole pharmaceutical industry. Then the first activity we done is not training for the PRP. Okay, by this Shihao, and then one of our committee members. And then we also advocate industrial pharmacy among the pharmacy students. And we managed to collaborate with Monash University, to share our experiences to the students. Then same also go to USM. I managed to share what is the so-called the role of pharmacy in a corporate and the role of pharmacy in the industry to the students. Hope that more and more pharmacists will join this corporate and also the production. Okay, then we also participate through this Sharifa. Okay, Sharifa is basically, she was the one of the member of our FFM. Okay, she also participate in the Masa International Pharmacy Conference to share her so-called her experience. Okay, what are the coming activity that we plan to do? One is, you see, we don't know how many people, how many pharmacy are in this corporate or sales and marketing. So I think it's a time for us as a MPS, we need to do a survey to gather the number of pharmacists working in the pharmaceutical industry, be in a corporate, the owner of the company, or so-called GM or MD of the or manager of the pharmaceutical company. Okay, and how many in the manufacturing line, how many in the distribution line, and how many in the sales and marketing. I mean, in like those pharmacy who are in the sales and marketing, they not necessarily to use their poison A license, but we need to know. We want to know how many are in this so-called the facility, so that we can gather and we can gather everybody together to not to empower pharmacists' role in this corporate and also in the pharmaceutical company. So hope that one day the whole pharmacy, this is my dream from since I graduate. My dream is basically to now one day we can see that the whole pharmaceutical industry are managed by pharmacists, okay, who are the medicine expert. Second, we are licensed with university to make the pharmacist curriculum more relevant towards the pharmaceutical industry. And then third is to provide pharmacy undergraduate and graduate more insight into the possible career opportunities in the pharmaceutical industry. So, so-called the last one, I think, is basically we would like to organize some physical activity to create more fun among these the industry player. So we will work closely with the association that I mentioned earlier, especially the Pharma, MOPI, and MAPS, to work together for the betterment of the pharmacy profession in the whole pharmaceutical industry. Okay, then how to contribute to this chapter? Basically, I'm calling all industry-based pharmacists to come and join this chapter. Okay, so your presence is very important. Your presence will be appreciated, and we have this you call WhatsApp group to include all the pharmacists who are working in the industry, and let us work together to create the opportunities for all industry-based pharmacists to network and exchange ideas for the advancement in the profession. I think it's important, and hope you pass the words. Please help me to share and pass the words around to your friends, pharmacist friends who are in a corporate or production line. Get them to contact me so that we can gather everybody together. And this is my contact number. So please feel free to contact me. So if any question, then I can answer. Thank you.
Thank you so much, Mr. Andrew Tan, for the very enlightening presentation. Yes, now industrial is the blue ocean, and like Mr. Rahi mentioned yesterday, right? We hope that we can get all of you in and contribute and help up to build this blue ocean for all of for the future young pharmacists. We have about 5 questions from the chat box, from the Q&A box. Andrew, do you have at least 2 minutes to answer those questions?
Okay.
Okay.
I think the first question is any training available for community pharmacy who wish to explore the industrial and regulatory area. I think at this moment, I haven't seen any official so-called training module for this community pharmacy, but I think we can share our experiences to all these, to those who are interested, and then they can get to know more about these industrial pharmacies. I believe that all my community with different experiences, they will share their experiences to you, and then this is how you get to know the industrial. In the past, my experience is a lot of community pharmacy or hospital pharmacies, when they hear all the sharing, and then they join the so-called the corporate for the betterment. And there are a lot of funds working as in a corporate. Okay. Then there's one. How? Okay.
Sorry. So
This is a very interesting question. This one I want to answer. How does one transition career from retail hospital setting in MNC pharma? Is being a sales rep prerequisite? Okay, basically you want to be in a corporate, especially sales and marketing. I think this is not a lot of times. Young pharmacy, even I can say like most of pharmacy, they thought that they are is a so-called in terms of knowledge is very superior, in a superior position, so that the experience is not really important. But my experience tell me it's good to start from basic. If you have the opportunity, start with doing a sales rep job, and then you will know the basic and you know your customer well. And then when you move up to the product management or marketing, even the management, then you will have the knowledge and experience to manage the company or manage the product well. Okay, so this is I'm sharing from my experiences. Okay, some pharmacies are not attached to pharmaceutical company per se, but with other industry, direct sales, marketing, cosmetic industry. For this group of pharmacy, how do we fit in? Okay, as a pharmacist, yeah, you talk about direct selling, multi-level marketing. I think there is a role, but one thing is, as a pharmacy, we must know our ethic. Okay, professionalism. So everything we do, we must base on the so-called facts, not clinical study, clinical paper, and we don't simply claim. Okay. Is there a scope for job description fixed for pharmacy in the industry setting? Some of us, the question ran away. What is the question? Shereen?
Hold on. Oh dear. Sorry, can you just answer the last one?
Okay, this one is
so the rest of the question we pass it to you later.
Okay, GMP is a good manufacturing practice. Basically, it's applied to all the manufacturing production. So basically, in Malaysia, I'm very happy is our Ministry of fixed so-called a policy that is compulsory to have a pharmacist as the head of manufacturing, especially those who want to apply for GMP certification. So this is good for pharmacists. This is a first step. So that hopefully in future, pharmacy is required for GDP also. which is a good distribution practice. All the distributor must have pharmacies to run the operation. Okay, so this is do I answer the question? So this chapter basically we want to get change of government policy also to get more pharmacies to be involved in the pharmaceutical industry, especially the company who supply medicine, even the OTC product or non or cosmetic item, which if you the moment that you want to apply for import license or a distribution license, which involve GDP, which is called good distribution practice. So pharmacy should be now one of the criteria compulsory to hold the license. So basically this is the right of a pharmacy. So we need to take charge of this. So this is our aim also for this chapter. So we want to gather more people.
Okay, thank you so much, Mr. Andrew Tan, for sharing, for the wonderful sharing. So we hope that we get more people come in and help to contribute and build up the chapter